Hello students, in this particular video we are going to study the nutraceuticals. Today we are surrounding of many type of ailments and together with that many type of treatments. And it is better to have something which can cure you and simultaneously have some nutritional benefits for you. So let's begin with the further. We will move ahead with this. So first of all, we will see that what we are going to study in this particular video. So first of all, we will understand that what are nutraceuticals. Then what are the understanding and definition and legislation and how the other countries see towards the concept of the nutraceuticals. Various laws which governs nutraceuticals in India, the classification system of nutraceuticals because that is also very important when we are going to study any type of thing. Then what are advantages of nutraceutical over the other therapies? What are the disadvantages also? We need to understand that also. And some general examples of nutraceuticals that are around us, but we need to see that we also have these things. So let's begin. So first is, what are nutraceuticals? So the Greek physician Hippocrates, often known as the father of medicine, said, let the food be the medicine and medicine be the food. So if we see that in our daily routine or the stories we have heard from our, elder people like mother or grandmother or grandfather, like we used to take this thing in to overcome the ailment. So those things were, many of them were, some household things, something from the kitchen. So this is the same concept. Now I will give you a very small and practical example. If someone asks you that you should take some, that Karela, dried Karela powder to overcome or to manage your diabetes condition, and if you are consuming Karela in dinner, how will you justify that whether it is giving you nutrients or it is providing you some medicinal value? Because in both the cases, only the objective changes. But Momordica chilentia, that is Karela, it remains the same in both the conditions. So the philosophy behind is focus on prevention. The term nutraceutical was coined by combining the term nutrition and pharmaceutical in 1989 by Dr. Stephen D. Willis, who was MD and founder and chairman of Foundation for Innovation in Medicine. So the concept clearly indicates that it is a combination of two words. What is that? Nutra and ceuticals. Going ahead, we can also see a nutraceutical is any substance considered as food or its part, which in addition to its normal nutritional value provides health benefits, including the prevention of disease or promotion of health. This we have also already seen that together with providing you nutritional value, if it is giving you the prevention of the disease, it is better to have that. It is any non-toxic food component that has scientifically proven health benefits, including disease treatment or prevention. The functional component of the food must be standardized in the nutraceutical product and produced under good manufacturing practice. So the only thing is that we should know that what for this nutraceutical is used. It must be a standardized product and it must be manufactured as per the GMP protocols. Nearly two-thirds of the world's 6.1 billion people rely on the healing power of plant-based materials for many reasons, like availability, affordability, safety, or their belief in traditional affordability, or also in the belief in traditional cures. Nobody wants to take medicines just for fun, or they also know that they have some or the other side effects. So this is again a very big rely on the nutraceuticals or the plant-based drugs that if we want to take medicine, then it should be with least side effects. And furthermore, many ailments like cancer, diabetes, hypertension, those are hardly curable. Rather, we can say they are manageable. So for those ailments, any person don't want to take unnecessary medicinal products that, synthetic ones. So medical benefits of food have been explored for thousands of years, and modern pharmaceutical industry began to develop during 1980s. So again, we can say that these what we are discussing nutraceuticals, these are combination of nutrition required for health and pharmaceuticals that is remedy for sickness or injury, and combinedly they become nutraceutical. With the advancement of science, we have seen many type of formulation floating in the market. Some we can call it as potential nutraceuticals, like one which has promising approach towards particular health or medicinal benefit, which we know. And another is established nutraceutical, that is a potential nutraceutical becomes established nutraceutical only after there are sufficient clinical use to demonstrate a benefit. You can see that if we talk about the nutraceuticals, or we can say the household remedies, there are many concepts which inherit from one generation to another generation in verbal communication, in many stories or in many discussions. But all those are potential, could be potential nutraceuticals, but many of them are not scientifically proven. So once it becomes scientifically proven, then it is established nutraceutical. Before to that, it could be a potential nutraceutical because the efficacy of that nutraceutical is not established yet. So now, what are the definitions in various countries? Which what are they taking it? So in United States, a diet supplement that delivers a concentrated form of a presumed bioactive agent from food presented in a non-food matrix and used to enhance health in dosage that exceed those that could be obtained from normal food. In Japan, it is said as a functional food, that is a natural formulated food that has enhanced physiological performance or prevents or treats a particular disease. In UK, it is said as a food that has a component incorporated into give it a specific medical or physiological benefit other than purely nutritional benefit. In Canada, a functional food has been defined as a similar in appearance to conventional foods consumed as part of diet, whereas a nutraceutical is a product produced from foods but sold as pills, powders, and other medicinal forms not generally associated with. So these are some of the definitions which are used by many countries and their understanding about the nutraceuticals. Now, there is another problem with nutraceutical that there is no proper law governing nutraceuticals since they are food products. So there are many laws which governs a food product. As we all know that there are many types of foods available in the market. Dairy products, oils, and other fruits, vegetables, pulses, meat, poultry, and infant food, right? Concentrated foods. There are many types of food available in the market. So if you just see the list. Prevention of Food Adulteration Act 1954, Standards of Weights and Measurement Act 1976, Infant Milk Substitute Act, Edible Oil Packaging Order, Food Product Order, Meat Product Order, Milk and Milk Products Order, Vegetable Oil Product, Atomic Energy Act, Consumer Protection Act, and similar other laws also. So we can see here that there is a problem that we have to, the government has to see this as a potential, lacuna in the system so that we can club all these laws together and put it in a frame to make these laws much simpler, much sustainable, much understandable, so that if one can go for a nutraceutical product or a nutraceutical company or nutraceutical market, he or she should not have run here and there to see all the laws which governs a food product. There should be, a unified law. But yes, as of now, this is the condition. Now, talking about the classification of nutraceuticals, we can classify it broadly into three categories: nutrients, herbals and phytochemicals, and dietary supplements. Whereas nutrients includes vitamins, minerals, amino acid, fatty acids, and similar substances. In herbal and phytochemicals, we have learned many herbs and botanical products like aloe vera, curcuma, clove, ginger, rhubarb. There are many herbals which we have learned in other subjects like pharmacology. There are dietary supplements also: probiotics, prebiotics, antioxidants, enzymes. This we have studied many times in different forms. Like we will discuss it further that what are probiotics, prebiotics, antioxidants. We have learned that it works in many areas because oxidative to reduce oxidative stress. It is good for treatment and management of many diseases. Many enzymes like papain, diastase, pepsin, many are working for the betterment of your gut. Probiotics and prebiotics, these are used in many cases, improving your gut. So this is one type of classification of the nutraceutical. Another, we can say that there are some traditional type of nutraceutical, and another, of course, could be non-traditional. In traditional type of nutraceutical, there are there we can divide it into three categories: chemical constituents, nutraceutical enzymes, and probiotic microorganisms. In chemical constituent, it is herbs, that is aloe, mentha, turmeric, and many others. In nutrients like vitamins, minerals, amino acid, and in phytochemicals, the isolated products of the herbs like carotenoids, flavonoids, polyphenols, alkaloids, glycosides, tannins, resins, and similar products. In nutraceutical enzymes, we can again categorize into three parts: from plants, microbes, and animals. Like in from plants, pectinase, bromelain; from microbes, catalase, amyloglucosidase; and from animal, trypsin, pepsin. In probiotic microorganisms, we can have lactobacillus acidophilus, enterococcus, streptococcus, and similar microorganisms. Now, if we see the non-traditional type of nutraceutical, that could be fortified nutraceuticals, like orange juice, fortified with calcium milk. You can see here that in many of the cases we used to take orange juices and calcium differently, right? But if we see that the requirement of these two in particular, problems or requirements, so we can feel it as that orange juice, calcium, iron, these things we require in almost altogether in a particular type of ailment. Like for weaknesses, we used to take many of these things. Whenever there is a person in a hospital, and if he or she is getting discharged, the doctors used to say him, "Bhai, khana pina khaiye, acha juice woos pijiye, badhiya." So if we add some calcium or iron or similar minerals into orange juice, it would be better to have one product rather than multiple. Fortified with calciferol, vitamin D. Recombinant nutraceuticals, products from recombinant plants, animals, microbes. So the research is going on in many aspects. Now here are some of the advantages of nutraceuticals. They are substances like food and not considered as a drug, so have less or fewer side effects. They are mainly used as a preventive or prophylactic to improve a medical condition. So it is, we have learned that prevention is always better than cure. So it is better to prevent the start of the disease. They have natural ingredients, dietary supplements to balance diet descriptions. So it is better to have something which can cure you, which can prevent the occurrence of any disease, and together with that, it would supply you the dietary supplements too. They enhance overall health and well-being, and they are available without prescription, means accessibility and affordability would be better than any other synthetic products. So here are some of the advantages, but not all things are advantageous. Rather, few disadvantages are also there with the nutraceuticals. So now we see the disadvantages. And disadvantages includes quality and regulatory issues. As we all know that of course the food items are what? Plant-based products mostly. And plants have so many variabilities. So many variabilities. So if it has so many variabilities, and there are possibilities that the chemical present in one batch varies from the chemical present in the other batch. The regulations are not sometimes up to the mark, so that we can give an assurance that the product is of good quality. The bioavailability is a big issue. We hardly know all the interaction between the herbs. The bioavailability varies from person to person, the condition to condition, which food we have taken with which type of another herb. There could be placebo effect also. We all know that there is a psychological impact of the drug. Some people, they start getting themselves a feeling of well-being, even if the doctor says or the pharmacist says or someone says, तुम्हें तो कुछ नहीं है, बस ये खाओ और ठीक हो गए. तो चाहे उन्होंने चीनी की गोली दी हो या कुछ भी दिया हो, but they start feeling something better. So it is a placebo effect. So whether the drug is acting for that thing or it is a placebo effect, it is hardly to differentiate. The safety in interaction issues. Since they are over-the-counter preparations, so safety is a big issue. We don't know the exact dosage that is required for an ailment. We hardly know the interactions also. Herb interaction, herb food interaction, herb drug interaction. We hardly know about them. Here are some of the nutraceuticals that are around us, like dietary fibers, cellulose, hemicellulose, gums, pectin, lignin, and these, play a huge role in controlling many factors like, it improves our gut. It also interacts with the lipoproteins, low density lipoproteins, so it controls the cholesterol level. PUFAs. What are PUFAs? Polyunsaturated fatty acid. There could be two types of PUFAs, omega-3 fatty acid and omega-6 fatty acid. This is very good for our heart. Probiotics, lactobacilli, enterococcus, these are used for, as a good bacteria of the gut. Prebiotics, these are the foods which improves the growth of these microflora. Fructose-based oligosaccharides. There are many minerals, calcium, iron, magnesium, phosphorus, chromium, cobalt, copper, iodine, and we all know that these minerals are good for health. Many vitamins, A, entire family of B, B1, B2, B6, B12, vitamin C, a good antioxidant, vitamin D, very good again, used in many ailments. Vitamin E, again a very good antioxidant. Vitamin-like compounds, inositol, taurine, choline, polyphenols, many spices in the kitchen we used to have, but sometimes we take it as food and sometimes we take it as a medicine. If we observe, some nausea and vomiting, we can put a, piece of ginger onto the tongue. It affects, it has anti-emetic effect. So there are many things which are used as nutrition. Together with that, also used as a drug. Here are some of the plants which are being used as drug, and we have learned in pharmacognosy also. I have given a few drugs here like aloe as anti-ulcer, wound healing activity, artemisia anti-malarial activity, allium sativum atherosclerosis lowers cholesterol level, capsicum annuum antioxidant and stimulant action, curcuma longa inflammation, indigestion, antioxidant, and many other function it has. Glycyrrhiza muletti, anti-inflammatory, expectorant action, plantago veta, laxative, Amla, anti-aging effect, antioxidant effect, ginger, indigestion, antioxidant, clove, dental analgesic. So at the end we can say that there are many type of plant-based product, many food-based product which can also be used as drug, and together with that it gives us many good effects. Thank you very much.